You know, this is a stressful time for many families here in Green Country. We're trying to balance it for you, help you as much as we can. And with so much uncertainty and isolation, that can cause emotions and tensions to run high. In tonight's Ways to Help, problem solver Erin Conrad talked to Family and Children's Services about why this could actually become a more dangerous time.
The doors may be closed here at Family and Children's Services in Tulsa, but the resources available at the center are not. Christine Marsh is the Senior Director of Child Abuse and Trauma Services. She says two of the biggest concerns right now are child abuse and suicide.
So we have a lot of people in disarray right now, not being able to make normal contacts, have normalcy in relationships, and some are very stressed about the finances and if they'll even have a job when things are back to normal. So a lot of critical factors are in place right now that can cause disharmony in families and for things to disrupt.
According to Family and Children's Services, 1 in 5 child abuse cases is reported by a school professional. Now, with school out for the rest of the year, cases could and will go unreported, especially with the stress on families unprecedented.
The first and biggest concern is isolation in general. We know that when families have things going on or the stress is high and the tensions are high, that people can isolate, and then we'd be in a situation where children wouldn't be able to be seen by others and people wouldn't be able to report the abuse. The same goes for, other kind of domestic violence and whatnot.
Family and Children's Services is expanding their telehealth operations, providing video chat opportunities and phone calls with therapists. The calls are for just about any type of issue, from parents at their wits' end to those dealing with mental health issues and addiction. The phone calls, an emotional support system. Staff can also offer tips for tough parenting situations and talk through thoughts of suicide.
But oftentimes when someone starts talking about things when they're at that critical point or that crisis point, it can certainly bring that crisis down, and it could actually prevent additional harm from happening.
If you are personally worried about a family that you know or an individual that you think could be struggling to cope with the stress, Marsh says call them, FaceTime them, connect, now more than ever. And if you are struggling yourself with your kids or your own mental health, there are some simple things that can help.
We're really recommending that people get outside, make sure that they try to have a regular sleep routine and waking up routine, and just to get some of those routines in place. And maybe a regular playtime with their kids or activity time with their kids, so that kids aren't having to wonder when or if they can mom or dad when they're home, if they're trying to work from home.
Family and Children's Services has a COPES COVID emotional support hotline, as well as a COPES crisis hotline, both available 24 hours a day, 7 days a week, and completely free. They've also posted parenting tips and resources on their website. Of course, we will provide those phone numbers and those links inside this story on our website, kjrh.com. At home, Erin Conrad, 2 Works for You.